I'm Dr. Aaron Bashong. I practice up on the hill, very close to here at Lots of Smiles. Basically today, I'm just going to kind of run through, obviously a little bit about dentistry, what dental school is like, applying, all that sort of stuff, kind of what went into that decision. Going to touch on the different career paths through dentistry, the different specialties that are involved, or that are options to get into, and then kind of walk you through just a typical day for me in my office, and kind of show you some of the stuff that we do. And so hopefully this is right after lunch. No one ate too much because some of it may not be the most appealing things you've ever seen, but tried to leave the most of that stuff out of here. So obviously we're here for you guys to answer any questions. So if you guys have any questions while I'm going, feel free to interrupt and stop me whenever. If there's something that I don't touch on you'd like to know more about, by all means, ask. So, again, I'm sure you've all seen the building. It's very close to here. We just completed it kind of in the spring of this year. We moved in here in March, so it's been 6-7 months now. Things have been good. It's functioned great. We've got our ribbon cutting today with the chamber, so that fun photo op with the big scissors is happening at 4 o'clock today. So,
are you the only one in that building, or are there other businesses?
Yes, we have a tenant below.
Okay.
They just finished building out. It's a construction company.
Okay.
Out of Milwaukee. So, yeah, when we built it, we got that tenant in there, and now I feel like we're already running out of space. So I'm regretting the 10-year lease that was signed, but so we do have someone below us.
Okay.
Okay, so deciding to be a dentist, I guess, a little bit about my path. When I was an undergrad, didn't know what I wanted to do all the way through, which I would not suggest anyone going into that type of field do, because it made things a heck of a lot more difficult. I did my undergrad at UW Milwaukee, kind of took a pre-med type course load of a bio-sci major, and figured it would give me some options potentially in healthcare when I was done, but really didn't know. And when I got out, I actually was in the workforce for a couple years before I got into dental school. So what led me down that path? I mean, for me, it was really, like I said, I kind of want to do something in healthcare. The more I learned about it and what we do, which you'll see some of today, the more I realized it would be a good fit for me. It's kind of a artsy type job. You obviously deal with people all day long, and it's been good. So, like I said, the decision going in is the earlier that any of you who are thinking about a professional career in healthcare, the earlier you understand or think you want to do that, the better, because all the course load that you take going through your undergrad leading into applying to school, it's all geared to that for a reason. And it's not that it can't be done after the fact. I did it, a lot of people did it, but it's a very, very competitive thing to get into, and the earlier you know, the better. So, applying to dental school, I did it twice. I did not get in the first time I applied. I went to Marquette University in Milwaukee, which has, when I went to school, there were 80 spots. 40 of those spots are reserved for kids out of state, and 40 in-state. Our class was split 50-50 male-female. It's now a 100-person class, so they have expanded it some due to the shortage in Wisconsin of dentists. But it's still split 50-50 in-state, out-of-state. When I applied, there were 3,000 some applicants. Most of those are pretty qualified people, because it is a whole lot of work to apply. It's expensive, time-consuming process. There is an admissions test similar to medical school. It's called the DAT instead of the MCAT. So it tests your basic science knowledge, and then it has a separate part, which is kind of cool. They call it the PAT, which stands for perceptual adaptability test. So it's basically trying to measure your ability to manipulate things spatially in your head, which was, it was kind of fun taking this, it's the type of stuff you would do on a plane, like in a workbook, just looking at different objects and trying to, again, manipulate them in the head, because most of what we do all day, you're doing upside down and backwards, so all of those hand movements are, and I guess this is their way to kind of see if you have the ability to do that. So, as far as of those 3,000 applicants, I think they interviewed like 400 of them. So you go there on a day, I think there were, maybe it was more than that actually. They interviewed groups of people and then they would take one person from that. So your odds aren't great. I mean, the average student right now getting into Marquette, I think undergrad has like a 3.87 GPA. They test, they check your science, they have separate categories, so they measure your science GPA, so any sort of science class, they weight that very heavily. So again, the more that you know going into this, that you're going this direction, obviously the more you're going to try as an undergrad and put yourself in a position. My GPA was a little bit lower than that going in. I did well on the test, but I played baseball in college, so I think that helped, obviously, eventually get me in. But I feel very fortunate to get in, to be honest, because it's tough. I mean, it's a very, very, very competitive environment. So again, if it's something you want to do, it takes some work to get in. But unlike medical school, once you get into dental school, they're not necessarily trying to kick you out. Because once you, and that's part of the reason the process on the front end is so exhaustive, because once you're in and they lose your spot in the class, they've lost their tuition, because you can't jump in and just start halfway through or even a year through. It's a continuation, obviously, of things you're learning. So, we actually lost, I think, 4 kids in our class, 2 of which were to death. And they can't replace those students. So they're, the dental school experience is not necessarily, for me, it wasn't all that fun, to be honest. It kind of is what you make of it, like anything else, but the first year or so is very, very intense in terms of coursework. Dental schools that have medical colleges in the same school, typically, those students are together for the first year and a half. So you're taking, just your basic human bio stuff all the way through, and it's pretty intense, and all of that stuff is tested on our board exam. We have basically 3 different board exams. One is all of that stuff. It's all didactic, just bio coursework, basically, chemistry, all that fun stuff. And then the last one before you graduate is, more of a book work on dental, all things dental. And then there's clinical exams as well that you have to pass. But basically in dental school, you start learning right away. I mean, this is a picture of our sim lab at Marquette. So before they'll actually let you touch a human being, you sit there with these plastic heads for 2 years in a basement dungeon with no lights. And it is, you pretty much lose your mind down there, but it's, we pretty much learn how to do everything on those type of dots before we actually go into the clinic. The last 2 years, we see patients in the clinic, very few patients because everything has to be checked 400 different times, but you start to get to expose them to all the various procedures. Those patients are usually, lower income, people without insurance. Some people drive all from all over the state because we do all of the procedures there, and it's essentially free. I mean, it's very, very minimal cost. There's a huge, huge waiting list to get in. There was no shortage of patients, that is for sure, but it was the last 2 years pretty much heavy clinical and just learning all the ins and outs of dentistry. So after graduating, you take the clinical boards, or before you graduate, and then you have some choices. You can either enter the workforce, you can specialize, or you can do a general practice residency, which are becoming more and more popular, and that's just essentially 1 or 2 years more of training. It's typically done in a hospital university type setting, all over the country. They're competitive to get into, you have to apply, be interviewed, all that fun stuff. Typically get paid a little bit for it, so it's very similar to a medical residency. You get to get exposed to some things that you don't get to be exposed to in dental school, because in dental school they're essentially trying to teach you not to hurt people and not to get sued. You aren't walking out of there necessarily as a seasoned clinician by any stretch. There's a lot of procedures you get very little to no experience with, and a lot of the stuff that I do on a daily basis that, I never even saw there. So you learn that in residency, or you have to go learn it on your own through CE, which is a lot of what I did. I did not do a residency. I went straight into the workforce, and like I said, all of the fun things that I do that I'll show you later were all basically bought. I've taken a ton of CE since then to teach me the stuff that I wanted to get into that I did not get in dental school. So as far as the workforce right now, I can't imagine a much better situation for someone graduating school, other than the insane amount of debt that they end up with, which at this point is hovering $300,000+ for most cases. The workforce is amazing. I actually own 6 different offices around the state, so I employ other dentists. So I'm pretty in tune to what the workforce looks like and what people coming out of school or working as an associate are getting paid and looking for. And I've had recruiters right now tell me that they could fill 150 positions tomorrow. So it's very, very tough. I need help right now here because we're so busy. And there's work everywhere. It's ridiculous. It wasn't quite that way when I was out. It wasn't difficult to get a job, but I've been at this for 8 years, so in that amount of time, as baby boomers have retired and continue to retire, the jobs are plentiful. Again, as far as that debt goes with the dental school, I graduated, I think the average in my class was it was right around 225, and right now it's getting out of control. I've heard numbers that are pushing $500,000 in tuition costs. Some of the people that I've hired recently, like I said, they're in 3.5, which makes it very difficult getting out to do some things that were done previously, like buy and own a practice. It's tough because, with that amount of debt, a good chunk of your income is going to pay that back for 10 years. So those are things that need to be accounted for, certainly when deciding which way to go. So talk a little bit about the specialties now. So the other thing that you can obviously do is apply to specialty school after. All of these things, there's 7 recognized dental specialties right now. I believe there's 7 or 8 now. But all of these require additional schooling. They all limit the scope of your practice to that specialty. And they all have their pros and cons, certainly. For me, I stuck in general dentistry just because it kind of gives you the freedom to do all of it. We're not restricted in anything we do. So as I'll show you, I kind of dabble myself and do a lot of most of the specialty stuff as well. Most general dentists do not do that because it's extra training, it's extra work, extra responsibility. But for me that was appealing because I like to be able to provide people with as much as we can and keep things in-house, and I have control over the situation. So the general side allows you to do everything, whereas the specialty side it's making you focus just on that thing. I think probably the most popular one that most of you are familiar with, of course, is ortho. I would consider this potentially the greatest job on earth. they've got a good thing, the orthodontists. I mean, they're compensated well. They, you know, their work isn't nearly as labor intensive as what I do on a daily basis. But it is another 2 to 3 years of training after, depending on where you go. I know the program at Marquette was an extra 2 years. It is insanely competitive to get into. So you are looking in your dental school class at needing to finish in the top couple people to even have a chance in most cases of getting in, along with doing a bunch of, you know, fun stuff on the side. So that is the one downside. But obviously orthodontists move and straighten teeth. You know, I mean, that's about it. It's probably a lot more complex than you would think, but anyone have any questions so far? Endodontics. So endodontics is, by definition, root canal therapy. I know everyone hears about root canals and that they get a bad rap. Basically, root canal, you're treating an infected tooth. An infected tooth can lead to infected body parts, as you see here. You know, I see on a daily basis someone coming in with some sort of abscess growing off their, not necessarily the outside of their face, but certainly like you see on the left side there. That is just infection draining from the tooth outside of the tissue. So in endodontics, we go in and treat the nerve and blood supply, which is kind of that dark area in the middle of the tooth, all the way down to the tip. You can see that file sticking in there. That's how we do that. Go all the way down and clean and shape that out, and then it gets filled, like up in the upper left there. Whoever did that did a heck of a job, because that's, as you can see by the curvature of that, that's a tough one. So this is probably my least favorite procedure to do. It's very tedious. It is probably the one, well, it's not probably, it's the one thing I refer out the most to our endodontists in town, which there are 2 of. But it's an important thing to be able to know how to do, because people come in pain, you want to get them out of pain. I think that's one of the things that's helped my practice grow, is that we always take care of people that are in pain. And one of the things you can do is very quickly open the tooth up and at least start it, let everything drain out, and have the endodontist finish it. So this is bad endodontics. Now you guys probably haven't had a whole lot of dental experience, but you can probably tell by looking at that picture that something's not quite right there. So yeah, those white fillings were supposed to go down the canal of the tooth to the tip of the root, and they went out the side. So this is just an example. It's funny because in dental school, they constantly, in the middle of your lecture when everyone's half asleep, you know, they'll throw in a slide like this to wake it up, and everyone laughs at it, and it's like, you know, how is that possible? But I unfortunately see this sort of stuff come into my office on occasion. So, yeah, and what happened there is whoever did it just, instead of going straight into the tooth, that angle of the drill is off a little bit, and you perf right out the side of it, and you've got some issues. So the patient doesn't know, they're numb, and yeah, there it is. So
Would that particular patient be in pain because of that?
you would think, yeah, but you'd be surprised too, because once the nerve and blood supply of the tooth is removed, you lose a lot of feeling in there. Your bone doesn't have any innervation for the most part.
I mean,
So,
like after.
Again, you would think so, yeah.
Not really.
I don't know on this, it wasn't my patient, but yeah, you would think that they would for sure. Screaming children, how many of you have gone to First Impressions? Yeah? How many are still going there? Oh my goodness, you guys, come on now. Just like the slide, don't you? Yeah, that's why you guys are still there. So anyway, pedodontics are specialized in children, and now they have continued to push the envelope as to what a child is, as you guys are showing me. You know, we utilize them a fair amount. I mean, I'm not a huge fan of that right there. Pedodontists, to me, are they are expert child behaviorists, is what they are. I mean, that's what they're trained on. We always joke in dental school that, you know, the ones who were bad clinically would do pedo, because teeth are gonna fall out, you don't have to be that great at it, but that's not, of course, entirely true. What they are amazing at is, it's crazy. I mean, most of these guys they can handle a screaming kid real well. And they somehow don't scream. But most of their day is spent doing stuff like this. Hopefully none of you had one of those little silver caps on your teeth when you were little. But is your teeth, is you see early childhood decay like that, really the only thing they can do, we kind of do what's called a pulpotomy. It's a little kid root canal basically. And we put one of these stainless steel crowns on, and then it sits there and holds the space until the tooth falls out. Again, this is not my favorite thing on earth to do. As a family practice, we see a fair amount of kids, but the ones that are doing that, unless they're my own, are typically sent right up the hill. So that program is typically 2 to 3 years as well. Almost all of those are done in a hospital, and the ones that are 3 years, they get ortho training too. So some of the pedodontists have an ortho background as well.
So like the kids that are at first impressions, at what point should they stop? What do you think as far as stop going there and go to like somebody like you?
To me, it's all about behavior and what the parents want, obviously. I mean, we're trained to deal with children as well. Obviously not to the level that they are.
Sure.
But, you know, there's like all of this stuff, there's a time and a place for the child to be seen by first impressions or any pedodontist, and there's a time that it's unnecessary, you know, and so that spot differs for each person. But for those of you in here probably aren't kicking and screaming anymore and are out of ortho, you know, probably not necessary, but you know, you get a relationship with them and want to stay, and I think they keep them now. I don't know what the age is anymore, but they're holding on to them longer and longer if they can. So.
Even if you just need the less complications, like less having to like switch over and do new dentist.
In terms of
like just like an adjustment period, like if someone moves to like a different state, they have to get like a new pediatrician and new dentist, then there's just like.
yeah, I mean, you'd be surprised. There's people move around a lot. I mean, I think it's becoming more normal to, you know, go on Google and find the person that people like the best and, you know, head in that direction. I find that the older generation of patients are much more likely to stick around and stick with, but, you know, your guys' generation is much more likely to, you know, go on Yelp and find out, which is why stuff like that for us is very important. You know, that good reviews and good pub is an important thing. So, periodontists, none of you probably have ever seen. We have 2 of them in town. Periodontics is a study of the periodontium, which essentially is everything that houses the tooth, meaning the bone and the gum tissue around it. So they specialize in treating just that stuff. They leave the teeth alone. What does that mean? Well, they deal with a lot of people that have really bad perio disease. I mean, meaning, you know, bad hygiene, a lot of bone loss. So they're going in there and trying to halt that bone loss and keep it there. In some respects, trying to regenerate it. They're placing a lot of implants now. Obviously, implants are placed into the bone, so they're doing that. And they do a fair amount of cosmetic work too, tissue grafting, gum grafting stuff, where some people will have recession really bad on a few teeth. They'll take tissue from somewhere else in the mouth or body and graft it into place and those sorts of things. So certainly a lot different work than what I do during the day, but I do a fair amount of this sort of stuff myself. I do a lot of surgery in my practice. This right here is a picture of the before and after of a crown lengthening procedure. So we call the one on the left, even though it's not a smiling picture, you know, you see people all the time that when they smile, they've got a ton of gingival display, right? And their teeth look really short, and we call it a gummy smile because you see a lot of gums. So one of the things you can do, depending on where the bone is literally surgically go in and we pull the gum tissue up out of the way and remove bone up around the teeth and then sew it back together, and when it heals, you get that result. And it makes a night and day difference when someone smiles. You go from seeing all that tooth structure, or seeing all the gum tissue to, you know, seeing teeth without really doing anything to the teeth. except simply exposing them. So that's one of the things that they do. I do some of that as well on my cosmetic patients who need it. This the guy who made this slideshow for me must have just put this in here. So I just did this, I think, last week. So this was a patient who, and I don't have a smiling shot of her, but you'll have to take my word for it. She showed a ton of gum tissue when she'd smile. So what I did was kind of go in here and draw on her gum tissue with a Sharpie where I wanted that to end up. So now I can evaluate when she smiles, what is going to be showing. And then at that point, we just took a scalpel, and we did this all the way back through these teeth as well. Took a Sharpie, removed all of that gum tissue, and then we pulled all of her gum tissue back out of the way, and I removed bone about 2 to 2.5 millimeters above that. Kind of scalloped it, and now after it's sutured together and heals, she'll have, her teeth will be 3 millimeters longer. 3 millimeters doesn't probably sound like a whole lot, but in our world, it's a mile. I mean, that's a lot. So this is kind of what she looked like after I removed the bone. So yeah, again, this is probably about 2 millimeters of space. This is where it should have been, where her smile should have been. It was about right here. So that little bit, again, for cosmetic sake, for her will make a gigantic difference when that heals up. That's kind of a close-up of it. So you can kind of see where the bone and the root come together. That's about where she'll heal to. So, yeah.
Can I take a picture of that?
Yeah, sure. Yeah.
So with you said that you remove bone.
Mm-hmm.
At what part of where would you remove the bone from?
So her bone was about right here, okay? Right at about this margin. So we just go in with a burr and kind of move this back, and so I don't nick the tooth. When it gets real thin, we take a pretty sharp chisel and just kind of scratch the rest off and scallop it into what you see there. And I know that looks completely gruesome, but
My gums hurt just looking at it.
it's amazing how right after the fact they look better. Like, I sutured her together, and I mean, she smiles, and you're like, holy cow, I mean, this is a huge, huge difference. I saw her this past week, and she's healing nicely, so.
So how long before her gums will heal completely?
Gum tissue heals very quickly because it's so vascular. So, I mean, you've got such good blood flow to the mouth. That's one thing we have working for us. It heals very nicely. It heals quickly. She'll be okay. It'll take 3 months before things will kind of remodel to where we want them. But as little as, when I removed her sutures 10 days later, you wouldn't notice if you saw her now. I mean, it looked good. So it heals pretty quick. This is just one I found online, same procedure. So again, that sort of stuff. Now you're not learning that in dental school. I've taken a lot of CE, a lot of surgical CE. So it's just something. I mean, for me, I like to have those tools in at my disposal to be able to do, because when you're working on cosmetic cases, that sort of stuff, to just be able to do it yourself right there, it comes in handy in a big, big way. So you probably won't find any other general dentists in this area doing that sort of stuff, but so I don't want to freak you out if you think, God, I'd never want to do that. I want dentistry, because most of us don't do that sort of stuff. But I guess again, the point is that if you want to, that option is certainly there.
On the patient that you were working on, will she get braces then too, because her teeth the gaps are so wide? Or?
It depends. So those gaps are mainly a result of that tissue getting pulled out of there.
Okay.
When she came back, those were all filled in. You wouldn't
wow.
see any black in there, because the tissue will fill that spot back in once it gets yeah. So oral surgery, another specialty. A lot of you have probably met the oral surgeon as well. Wisdom tooth removal. Hopefully those experiences went well. Again, we do a lot of that in our office as well. They're pretty much doing one of two things. I mean, their day-to-day practice is wisdom tooth removal and placing implants now. That is an implant. An implant basically is a titanium screw that's being inserted into a spot where a tooth used to be. The bone then will integrate right into that titanium, so it is like a rock, and we can build whatever we need to build off of that. In that case, it's a single tooth. Over on the